Good morning, America. This is the Cats Roundtable. John Catsimatidis here, Sunday morning. Lots of controversies in our country. Lots of controversies in New York City. Legalizing marijuana. The mayor of New York City has told his police commissioner, don't make any arrests on marijuana. We had Judge Weinberg on the show, and Judge Weinberg has said, if you let your kids smoke marijuana, then they're going to end up being zombies. It's going to affect them. Today we have Dr. Philip Stieg, and the doctor is a world-renowned neurosurgeon, chairman and founder of the Weill Cornell Brain and Spine Center, and a leading neuroscience patient care center in New York City. Good morning, Dr. Stieg. How are you this morning?
I'm well, John. Thanks so much for having me on.
It looks like it, whether we like it or not. The mayor has issued a proclamation to police commissioner in New York, don't make any arrests for marijuana. Some people are horrified. Other people are thinking they're going to have a great time. But the medical aspect of it, and that's what Americans want to know from you this morning. If you allow your 16-year-old daughter or son to smoke it, what is the long-term effects, short or long-term effects on it? Doctor?
Well, I'm glad you asked the question that way in terms of short-term versus long-term. We really don't know. Unfortunately, there's really not very much research on the long-term effects of prolonged regular usage of marijuana. So, I can't give you really good scientific data. We certainly know in terms of short-term use that it has effects on both your brain function through two ways. Number one, it affects the release and responsiveness to neurotransmitters, your normal brain chemicals that make your brain cells function. In addition to that, there are also specific marijuana receptors within the brain that the marijuana affects. And it can have effects on both the cognitive, meaning the memory function of your brain and learning, but it also can have an effect on the coordination parts of your brain called the cerebellum. Hence, patients feel a little bit out of touch. They've lost their memory a little bit from smoking, and they've lost their ability to have good judgment, but then they also feel unsteady. And then there are some other medical effects that we can talk about as well, and I think that that's why there's this push to consider opening up the floodgates for the use of marijuana.
You know, you're a doctor, and what would you do with your young ones or your grandchildren or children? You know, what would you advise them?
Well, I'm not a proponent of recreational use of marijuana. Just as the same, I'm not a proponent of overly excessive use of alcohol. I don't think that the discussion should be framed as such that when you smoke marijuana, you're doing it for a particular effect, but then we try to justify it that people drink too much as well. Obviously, doing both is harmful to your body. I certainly wouldn't want my children losing their judgment or having an incoordinated episode such that they could hurt themselves. So my advice to my children is not to use it as a recreational form. I would hope that they find other healthier ways to be at peace with themselves and to relax.
Now, once the damage is done to some of your how long does it last, and does it come back?
Well, the effect can be variable. Some people within a couple of hours are fine, and other people it can have over a 24-hour effect on them. Some of that is dependent upon where they get the marijuana, what type of marijuana they've taken. In addition to that, the impact of inhaling marijuana through a cigarette or through an inhaler has a much more rapid impact on your body than if you ingested, say, in a brownie.
That's understood. But the long-term implications, it's not any scientific facts on it yet, you feel?
Correct. We don't really know. I mean, it's an entry-level drug, but there certainly have not been prolonged long-term studies doing formal neuropsychological and motor skill assessments on patients that have used marijuana. And the unfortunate part is doing it retrospectively, where we would look at, say, somebody that's 50 that has been using it for 20 or 30 years. Frequently, they have had adventures with other forms of drugs, so it kind of clouds what the real impact of marijuana is.
I mean, the joke some people use, it's not really a joke, but that they walk around like space cadets.
Yeah, I mean, yes. I mean, people will lose their perception, again, depending upon how much they've inhaled. The early form is you just feel a little bit light, you feel a little bit happy, and you feel a little bit hungry. But if you then smoke more, you can start losing your executive function. And by that, I mean you lose your judgment and your perception of your surroundings. And then you can certainly have incoordination problems, such as you could stumble and fall and hurt yourself. Now, I want to emphasize, however, that there are some areas where the use of marijuana may be beneficial, and this is where we really need to look at it prospectively. And what I'm referring to is patients that have terrible cancer pain, or patients that have severe headaches and other types of pain syndromes.
Well, at that point, you're not worried about long-term effects because you might not be around.
Yeah, I understand that.
Yep.
But in the pediatric population, certainly children metabolize all forms of drugs differently than adults do. So common sense would have to be that you don't want your children to be compromised in their judgment in any way. One must also remember that the male brain develops a little bit more slowly in the frontal area than the female brain. Female brains are usually fully developed around the age of 16 to 20, whereas the male brain is fully developed between 20 and 25. And the frontal lobes are responsible for judgment, understanding consequences of activities. These are things that are compromised by smoking marijuana.
Understood. Dr. Philip Stieg, Chairman and founder of the Weill Cornell Brain and Spine Center, thank you so much for coming on our show this morning and giving us a better explanation about the marijuana problem. And we'll catch up with you again real soon.
John, always a pleasure.
Take care. This is the Cats Roundtable. We'll be right back.